Tēnā koutou katoa. Ko Mount Peel te maunga, ko Orari te awa, ko Kouturana te whare tūpuna, ko Ngāti Pākehā te iwi, ko Ngaire Kerse Tokawingawa nā reira. Tēnā koutou, tēnā koutou, tēnā koutou katoa. So I'm Ngaire Kerse, the Joyce Cook Chair in Ageing Well at the University of Auckland, and I really enjoyed helping Jo with this report, and I'm just going to talk for a few minutes about the New Zealand population demographics. So here I'm going to share my screen, and hopefully the right slides will come up and we'll work through them. So this is what we're talking about, older Māori and aged residential care in Aotearoa. We really thank the Health Quality and Safety Commission for funding this report, and pleased that we can talk about it today. My part, demographic projections and existing data about aged residential care. So the demographic projections, we know this is happening to our 65-year-old numbers and 65-year-old percentages. There we go, 53 to 73, similarly with the 85 pluses. Let's look at the New Zealand population projections for Māori, and you can see 2013 to 2038, total Māori population, and then the percentage rising from 17% to 21%. In contrast, looking at the older population, the 65 pluses, these go from 6% to 12%, a doubling. So there is a similar aging of the Māori population as we saw in the previous slide. Of more interest is the aging within that older age group. Busy slide here, so let's just look along the rows here. We can see in 2013, of those over age 65 plus, 41% and 28% were age 65 to 69 and 70 to 74 respectively. And that proportion, of course, there are far fewer people in those oldest age groups, 3.6% and 1.1% 90 plus, with just 400. Isn't that marvellous? Now let's look down the rows, and we see here there's a change, a systematic change in our population, with a lower proportion being in the younger, older age groups and a higher proportion being in the older age groups. And this is a tripling of those aged 90 plus years. Look, 400 to 4,000 actually. So the proportion is tripling, but actually the absolute numbers are going up by 10 times. So what will happen to these people as we pass our 2023 up to 2038? The total number of people in aged residential care, I want to thank Rebecca Nesbitt here, the numbers for these numbers. And if you look at the totals down here, you can see 651 potentially undercounted, because that's when we were starting to implement this assessment process, the long-term care facility assessment, rising to 1,200. So a relative doubling from up to 2019, and that was just a half-year number of older Māori. So in comments, we can say there's quite a few people from the 55 to 64-year-old age group in aged residential care, about the same numbers as in the 65 to 69 and 70 to 74. The largest numbers are in the older age groups, as you'd expect. When we look at Māori in care, the mean age is 77.2 and non-Māori 85.9. So definitely younger age in aged residential care. Looking at projections, there'll be a fourfold increase in ARC needed over the next 20 years. And there's a suggestion that aged residential care is inequitable and with representing reduced expenditure for Māori compared to non-Māori. And so we're very interested in talking more about that. Let's look at a little bit of Lilac's New Zealand data, my favourite study. And so this study is a longitudinal cohort study, gathered together 400 Māori aged 80 to 90 and 500 non-Māori aged 85 years in 2010, and has followed from one region of New Zealand, has followed them systematically for 10 years. When we think about the care home placement, We can see that the entry to long-term care is in this row. We can see of the 860 people, of 400 Māori, 22% were admitted to aged residential care during their 6 years of follow-up. And for non-Māori, 41% of that 469 were admitted. This is a clear difference. Is it a disparity? We need to consider whether it's a sensible choice or whether it represents a restriction in access. When we look at the predictors of residential care placement, we see that they differ for Māori, with living alone and being of older age driving the admission. And for non-Māori, it's much more closely related to their ADL status or disability status and self-rated health. Aged residential care is thought of differently and used in a different way for Māori in old age, and we need to think about whether it's an inequity or not. Okay, I'm ready to hand over to Jo Hikaka, and I wish you well for the rest of the webinar. We will be available for questions shortly.